Good morning everybody. We are here today for the workshop on General Club and General Club critiquing and its appraisal. In order to tell you more about the General Clubs now, today we have with us Dr. Nagesh, who is Professor and Head Department of Public Health Dentistry, BAPUJI Dental College, Davangere. So we welcome you from the Department of Medical College and SS Institute of Medical Sciences wholeheartedly, sir. I request Deepthi Madam to give a token of bouquet to sir. Department of Medical Education is fortunate today because Principal after his long break, he is at our inauguration function for the first time after his long break. So we thank you and welcome to have you here, sir. Niranjan sir, to hand over a bouquet to sir.
Thank you.
Now come to the madam who is all instrumental in getting this workshop done. He was almost behind me and also behind the Department of Medical Education to start this General Club meeting, because majority of the faculty and also we as the co-guides and guides don't know much about how exactly to predict the General Club. So thank you very much, madam, for conducting the workshop, and also thank you very much for being here today, madam. Thank you very much. I request Shantala madam to please give a bouquet to Shashikala madam. I request all the dignitaries to inaugurate the function by lighting the lamp, please.
Fan.
I also request Dr. Pooja Yavangal, who is also a resource person for today's function. Please welcome madam. I request all the dignitaries to inaugurate the function by lighting the lamp.
जैसे मैं join is Arun इधर करेंगे.
Sir, Arun sir. What's this?
Arun.
Viewers. Thank you very much, sir. I request Principal Sir Dr. P. Nagaraj to say a few words regarding this workshop.
Good morning. Dr. Nagesh, Dr. Pooja, my colleagues, first graduate students, ladies and gentlemen. First, I would like to thank you for asking me to inaugurate this function. And it's very nice of Dr. Nagesh and Dr. Pooja to come over here and share their experience with our staff members. Dr. Jason has said a few words. I think I've finished my few words. Thank you very much. I wish the function a grand success. Thank you.
I request Dr. Shashikala Madam, Coordinator, Department of Medical Education, to speak on this workshop.
There's a very famous quote which says, we can never learn guitar without hitting few wrong notes. And we'll never learn to say without tipping the boat few times. So this journal club, conducting the journal club, we use this as one of the methodologies in education system, especially for postgraduates. Now our institute has postgraduates, it's 2 years we have, and we have started conducting journal club. So what is very essential here is the critical appraisal of a journal article. And 2002 in JJMC I joined this medical education unit, and since then me and Dr. Mubarak were planning to have one workshop like this on journal club, how to conduct a journal club. I think it's a dream come true for me today to say that I have got the right person who is here, who accepted our invitation to come here and conduct this workshop for us. Because we see like how the journal clubs are conducted, where review articles are chosen and a lot of theoretical aspect is just discussed. I always say journal club is a methodology, a teaching methodology where we learn skills. It's skill learning. So we know what skills and what we learn by reading these journals Dr. Nagesh is telling us this morning. So this helps, of course, the student to become familiar with advanced literature in their field and study. Improves the skills. What skills? We may say understanding the current topic and debating it, help in application of evidence-based medicine. And what is very important in each journal club meeting is that every participant should voice their views. I know how it goes in many of these journal clubs, so various things starting from the checklist what Dr. Nagesh gave us, appropriateness of the research, design, statistical methods, controls used, everything. So even if the results are valid, as he said, so discuss about it. And each article, even though it's published in an index journal, it has its merits and demerits. We said look at the merits and the demerits both. I think after this workshop, I'm very sure, so the journal clubs which are conducted by the professors who are here and guides who are here will be different. So we look at all this, and as we go through the law book, our university also has given a checklist as to what we need to look at when a postgraduate presents a journal club. Let me thank Dr. Nagesh and his busy schedule also his every. So they are conducting a national level workshop on research methodology that is from 27th onwards for 3 days in BAPUJI Dental College. I know how much pains he is taking to organize that. So in spite of that, he is here today with us to spend the entire day to make us know how the journal club has to be conducted. So it was just over phone, I just contacted him. I never went to his office to meet him, to just over a phone call. And it's not just the journal club, he is very good in conducting there's workshops on research methodology, not just to dental college, or then he has gone to various universities and he travels throughout India, and it's so difficult for us to get his appointments. I have already fixed him up for 2 or 3, I should say more workshops on research methodology and other things for our postgraduates. I thank you, Dr. Nagesh, once again for having come here and for spending your valuable time and guiding us about this workshop. So I thank Principal also for having given us this opportunity to do a lot of workshops and teaching methodologies from medical education unit. I just want to tell you that October 1st week most probably we are conducting 3-day workshop on MET, that is medical education technology. It's a must for all the teachers, and this is conducted by the Nodal Center, that is MCI recognized Nodal Center, Belgaum. So we have one observer and a resource person coming from Belgaum. So I will let you know, and those who have not undergone this basic training, I want Mr. Seniors to get that, and maybe from next year or shortly the university MCI is going to ask this for recognizing whatever degree, not degree, but I should say status as a professor, whatever, and then we say put this as a criteria for increment, whatever, they're planning for that, and we are about 15, I think, who are trained in the regional center. With this workshop, I'm sure we would have 30 or 35 more who would get trained, and MCI gives us the certificate. So MCI certificate is so important for us to apply for anything. And Dr. Pooja is with us again as a resource person. Pooja is a student of BDC, and she did her BPS and MPS also from BDCH, and she happens to be the daughter of my colleague Dr. P.K. Mesraj. I'm very happy to see her grow and be here with her professor as one of the resource person. Very happy that all of you have turned out in large numbers. I'm sure by the end of the day, so we get a lot of knowledge, gain knowledge from this session. I thank Dr. Jaisima for organizing this, and people from medical education unit for helping. Thank you.
With this we come to an end for this inauguration workshop. I think I hand over the mic to Dr. Nagesh, Dr. Nagesh.
Thank you, ma'am. Questions are always helpful. We start applying whatever knowledge we gained. Let's start applying. We wanted to have some kind of background or ground knowledge that we had enough. We will continue, but meanwhile, I just like to know how we can interact and exchange our views and ideas. So I solicit your queries.
So I want to ask some question. You said that good quality journals to be discussed.
So I take your question. The question is, there are so many journals now, how to differentiate them as good and bad journals? Because we see sometimes bad articles in good journals, and good articles in bad journals. How to differentiate? The wonderful question asked by him. Anybody has any suggestion, any answer for this question? Do you like to share your opinion?
I'm not biased with the reason. Depending upon the institution, it will result in safe.
So, the gentleman here is adding to the question what was placed before the retinal doctor. He says that even the affiliation to which university or to which research center or to which hospital we are affiliated, it matters. When we are affiliated to a reputed institution, probably there is a bias, the acceptance rate will be better. That's what he says. Okay, there is an additional input you need.
So I want a critical comments that is said beyond the affiliations of the college, beyond the recognition of the institution as a research institution, and beyond what is called as an impact factor, the quality, what are the standards we use as a journal. Beyond this, as I said, it took less. And we see, I prove you so many examples I can quote you. Good articles in not so good journals, I don't call them as bad journals, and bad articles in so-called reputed, peer-reviewed international journals. I gave the answer. Not because somebody is doing a good research, they are recognized worldwide or in the national level. Whatever they say is good. Whatever they say is correct. It should be accepted as it is. No, it's not easy to do.
So, to reiterate, whatever is said in the reputed journal need not be true. and we need to strictly scrutinize the article for the quality of work which has gone into the study and then decide. That's what is the opinion. As disciples of science, I said we are disciples of science. We are not just students. There's a difference between discipleship and studentship. Okay, discipleship is a more intimate and an intense relationship. So as disciples of science, because we are a noble profession, we have to accept a piece of information only after scrutinizing it. Maybe it is an article of your head of the department. Maybe it's an article which is written by the stalwart in the field. It doesn't matter. Doesn't matter. Science doesn't believe in that authority. Science believes only in quality of evidence. So as rightly said by this person, we have to scrutinize it. Even if it has been published in New England Journal of Medicine or Lancet for that matter, Cell, Science, they are all very high impact journals. Cell has more than 80 as a fact factor. So, though the journal has a very high impact factor, as a reader, you or me for that matter, need to clearly, correctly scrutinize. Because, as he said, even we have seen in our dental journals, poor quality research being published in high impact journals. It happens. That's why the question, how to differentiate? The only one particular yardstick which was developed was impact factor. Every journal needs to have impact factor. But there are many journals which do not have impact factor. To get that impact factor, a journal has to keep publishing the issues for a pretty long time, and depending upon several criteria or factors, impact factor will be decided over a period of time. There are many journals which do not have impact factor. There are some journals which have very good impact factor, but the problem as such is, even impact factors are not able to clearly give us an idea which is a standard journal, which is a substandard journal. Because the very way of calculating impact factors itself has some inherent drawbacks. That's why we say now, there are not only impact factor, now there are many different kinds of factors given for every journal to locate where exactly it stands with respect to standards. But none of these are foolproof. As you rightly said, it's very good journal is now actually of a substandard. Why a kind of bad, rather than bad I use the word poor. Why a poor research gets into a good journal? The reason is, peer review system has utterly failed. Peer review system is a god, is actually a system which is evolved to filter out substandard articles. But if peer review system doesn't work to its full potential, then this is what happens. So this is what is the answer for it. And as I said in my slide, there is nothing called as black and white. Everything comes in shades of grey. You need to decide. That is the reason we need to read the entire length of article and come to a decision. It's a personal decision that you are taking. You are personally liable if you take a decision based on that evidence. The liability and the asset both stands on you only. Are you clear with it? So this is the best answer I could give for your question. Any more questions, please?
Sir, you say will not avoid the bias or rule out the bias, and you have shown us there are more than 100 bias which we come across in a research. So how much of it should be the minimum sample size for carrying out a good research?
See, there are two questions in what you asked. One, sample size, what is the correct sample size? So that the errors are less. Number two, bias cannot be controlled with sample size. What to do? Am I right? Okay. See, bias, however much you increase sample size, cannot be contained. Bias can be examined the parameters. how you maintain high level of precision, the validity and reliability of your clinical examination. If you are using a questionnaire, validity and reliability of the questionnaire. If you are using a gadget, valuability and reliability of the gadget. You need to calibrate the examiners or the clinicians or the investigators or the devices or the tools, the materials, all that has to be standardized. It's the best way to restrict the bias. And follow strictly scientific methodology. You are bound to incorporate bias into your study. However much you try, there is some amount of bias. There are methods to manage that minimal or residual bias. Many methods. Equally distributing bias between study and control groups. It's one method. Okay, let's not get into that, but there are ways. And this is one way, standardizing everything and taking care of precision and validity. And coming to your sample size, it's a very tough question to answer. See, sample size determination depends upon what parameters you are measuring. Whether your parameters are on continuous scale or on categorical scale. Say for example, you are trying a new drug or a new method on oropharyngeal cancer. Okay, you are comparing it with standard care which is being in vogue now. You have two groups. Okay, recovery you are actually measuring in terms of how many people survived at the end of 5 years in treatment and in control. Are you following me? You are categorically dividing. Are you understanding? How many survive, how many are dead? In group 1 and in group 2, you have categorical variable. When you have a categorical variable like that as an outcome parameter, you need a large sample size. If you are measuring it in terms of some units, like regression in the oropharyngeal carcinoma, the size, so many centimeters it regressed, or so many millimeters it regressed. Okay, are you following me? Instead of finding out how many survived, how many dead, what are you doing? You are measuring the dimensions of carcinoma. How are you measuring? Probably the length, breadth, whatever it is, centimeters, millimeters. That is a continuous scale. When you use that continuous scale, you naturally require slightly less sample size. Calculating sample size itself is a wonderful area. Sample size calculation depends upon many factors. You need to set what is the alpha that you are comfortable with, type 1 error. What is beta, type 2 error, comfortable with. And what is type 3 error, what is type 4 error. These are the two further errors which have been added. You need to be very clear how much is going to be acceptable to you. And then you should fix the power of the study. What we call statistical power of the study. Statistical power of the study should be no less than 80%. If it is less than 80%, you are bound to get a false negative result. When you get a false negative result, you say drug is not effective. But in reality, drug is effective and your study is not able to find out. Because the power is less. Look, there is a brilliant student in my class. I should have enough power to detect that he is intelligent. If I do not have the power, though that boy is intelligent in the exam, I don't detect that he is intelligent. This is what is called as power of the study. If your sample size is adequate, it will fight against your false negative error, what we call as a power of the study. Please excuse me, sample size determination itself is a wonderful area. Sometime again, when I am given an opportunity, as Dr. Shashikala was discussing, now was discussing, statistics will be another workshop, basic health statistics, then probably we can get into the depth of it. One thing is for sure, sample size determines ultimately the errors that get into your study. What is the right sample size? Use the formula. There are different formulas. For t-test, one formula. For chi-square test, another formula. Like that, there are different formulas. Please apply the appropriate formula, calculate the minimum sample size. In case if there is dropout, expected dropout, let us say it is a longitudinal study, 5 years, Down the line you expect 30% dropout. What should you do? Add that 30% extra to the minimum sample size. So that even 30% dropout, your sample size still remains adequate. It gives you the statistical power to detect. But dropouts always cause a bias called as dropout bias. If in your study dropout is more than 20%, definitely dropout has resulted in a bias. You should do dropout analysis. There is a way to do dropout analysis. There are many ways. Let me not get into the depth of it. Another thing, sometimes missing data we say. Data is missing because the person did not appear in the second follow-up, he came in the third follow-up. Then again fourth he did not come. What to do? When such a missing data is there, how to manage that missing data? There are many methods to manage the missing data. Following up the old reading only. Otherwise calculating the average at that particular follow-up period, adding the values of all the participants and dividing it from number of participants, take the average and put the average there. Are you following this? Are you clear with this? Are you clear? So there are many. Missing data management itself is a wonderful area in research methodology. There is something called intention to treat analysis, and there is something called per protocol analysis. Okay, better not, please. Things will go beyond head now. Let me not get into that area, but there are wonderful areas in research methodology. As a researcher, we need to know about it. Okay? Then, any more questions?
The minimum duration or maximum duration of the study?
The question is very clear and very precise. In a prospective study or longitudinal study, what should be the minimum time of follow-up or maximum time of follow-up? So, probably this question cannot be answered by a research methodologist. I am a methodologist. Okay, as a clinician, what are the outcome measures you are examining? How much is the minimum period required in order to see a clinically significant change in the parameter? You define it. You have to define. Clinicians have to define. The answer has to be given by the clinicians, not by the methodologist. And there is no hard and fast rule that it should be so many years, or it should be so long, or it should be so short. Nothing. It all depends upon what you are measuring, how much of clinical significance you are expecting. One thing is for sure, there is a design called sequential design in an experimental or a clinical trial. Sequential design means you have not fixed up the time period at all. You start the study, you have a study group, you have a control group. Drug is given in study group, placebo is given in control group. You continue examining them over a period of time. Every now and then when they come for follow-up, you take the data. Give the data to statistician. Statistician will start analyzing the data. The moment statistician will give you a sign, look, this is the third follow-up. For the first time I am seeing there is a statistically significant difference. Okay, then you can stop it if you want to stop. Or if your statistician says, look, I have gone beyond statistical significance. Clinically also I have found out effect size. Effect size also looks to be large now. Okay, stop it. Don't continue the study even after you find statistical significance or clinical significance, because unknowingly, unwantedly, you are not giving the benefit of drug to the control group. Isn't it? Even after seeing the effect, positive effect, if you continue the study for a long time, the control group is not getting benefited out of the beneficial effect, isn't it? You need to cater it to the control group as early as possible. That's why in sequential trials we develop stopping rules. We call that as stopping rules. When to stop the trial? They clearly write, if so much of statistical significance I get, I am going to stop the trial. Or clinical significance I get, I am going to stop the trial. So it all depends upon that, reaching that particular significance in the follow-up. Have I answered the question? Okay. I think now the time is up. Let me just rush through a few slides for your critical appraisal methodology. What can be is a stigmatized concept. What is the use in doing it? Okay, so she will deal with it. Dr. Pooja will deal with external validity or critical reflection a little later. What the student should do or the presenter should do when the journal club begins. The presenter should provide a little introduction to the topic. Let us say it is all about a new antiretroviral therapy which has been found to be effective. The article is dealing with it. The presenter or the student should give a recent information or the current scenario related to HIV and HIV therapy. So that's how he is beginning the journal club, by giving you a backdrop or an introduction. This should be brief and relevant. This should be primarily designed to facilitate a movement from general to specific. Abruptly, the student should not jump into the article. Provide a context, create a context, craft a backdrop, and then start and move towards a specific area. Then the student should identify the source of the article. This is called tracing the source of the article. The article has been picked up from where? What type of journal? Who is the publisher of the journal? Under what section of the journal the article is published? Is it under original article? Is it under short communication? Is it under economic analysis? Is it under practice guidelines? Is it under commentary? Under what heading actually that particular article is picked up? What is the ISSN number of the journal? International Standard Serial Number. Every journal will have this ISSN. ISSN for print version, ISSN for e-version. Both are there. The student should make a note of it. What is the mesh representation of the journal? Every journal will have a mesh representation of its own. Journal of American Medical Association. We call it as JAMA. We don't say full. Medical subjects heading representation or presentation. That has to be clearly mentioned. Is it a peer-reviewed journal or not? The student has to search and find out whether it is peer-reviewed or not. If it is peer-reviewed, we consider usually it is the article should have a better quality because it has undergone scrutiny. What is the year of publication? What is the issue number, volume number, page numbers? All that has to be written. And all that has to be presented in the slides. Usually in our department, the students present it using PPTs. How it should be titled. How it should be, I will tell, and then what are the questions we can ask. Title should be clear, complete and specific. A maximum of 15 words. It should present the focus of the study. Should give an idea about study population, study setting and study design. All this should be present in the title. Because when a person reads the title, he should get a fair idea of what is being done, where it's being done, on whom it's being done, and what is the central theme of the study. Title should include the primary variables. Primary variables means at least two variables are there, cause and effect. What is the cause and what is the effect that you are trying to find out association? Let us say the efficacy of new antiretroviral therapy on advanced AIDS patients in rural areas of Davangere. So it clearly says there are two variables. One is therapy. For what? Antiretroviral therapy. For whom? Advanced AIDS patient. What are you trying to find out? Efficacy. So the variables are very clearly mentioned. It should reflect the aim and objectives of the study. Once you read the title, one should be able to know what's being done and why it's being done. The title should be succinct, informative, meaningful. Implicitly, it should refer to research question. From the title, you should be able to generate the research question which is being picked up. And it can be made very catchy. Sometimes titles are made very, very catchy only to attract the readers. But it's need not that you always engage in creating a catchy title, because creating a catchy title has its own advantages as well as disadvantages. Science always deals with truth, with no exaggeration. Don't play with the words, that's what they say. Critical appraisal of the title. Does it indicate topic and focus of the study? See, that's how the title should be. These are the questions a student or a faculty should ask when the title is read. Does it indicate the topic and focus of the study? Does it reflect the research question? Ask the student, derive the research question out of the title. Can you derive? Find out. Is the title meaningful and complete? Does it reflect the aim and objectives of the study? Does it include the primary variables of the study which are intended to be measured? These are the questions which have to be asked when a student reads the title. Correct? Does it give an idea of study population or study setting? On whom the study is done? Where? In which setting? Industrial setting? Rural setting? Primary health center setting? Tertiary care setting? Setting means the place where it's being done. Does the title look catchy? If not, say there's no problem about it, just comment upon it. Is it very short, long or over long? Usually up to 18-20 words are permissible. Beyond that becomes lengthy. Is it too general specific or over specific? When it is over specific, there are too many words as such. Let's say assessment of post-lunch amnesia among general surgeons who are working in all ESI hospitals of Karnataka as measured at 2 o'clock in their hospital soon after having their lunch using a particular gadget when they were reclining on their chair and closing their eyes. What is happening? What's happening? It's becoming over-specific. Don't make it over-specific. So think what is relevant and what's current. Okay, abstract is an abbreviated, accurate representation of the contents. It gives a gist of the study. It should never exaggerate anything, and abstract should help a reader to immediately find out what the study is dealing with, whether it is of interest to him or not, what it contains, the purpose of the study, the outline of what was done, a summary of what was found, and what it all means. It may be